infections can only be diagnosed by a medical professional, and many diagnostic tests are used to detect it. Firstly, a practitioner will perform a physical exam and inspect any abscesses or boils to rule out similar conditions such as acne. Samples will then be collected with a cotton swab by rubbing over the sore and infected areas on the skin. If present, pus will also be swabbed. If septicemia is suspected, blood and urine samples will also be required, and if an infection is in the digestive tract, it will be detected through a stool sample. All samples will then be sent to a lab to be tested for the presence of Staphylococcus aureus, and results will be typically available within 2 to 4 days. If diagnosed with golden staph, depending on the severity of your infection, an echocardiogram may be necessary, also known as a heart ultrasound. This refers to the use of sound waves to scan and create images of the heart. This test can show the blood flow through your heart and its valves, which can determine if the staph infection has reached your heart. Staphylococcus aureus is a causative agent for almost all staph infections. This bacteria infiltrates the coagulation system in its host cells and causes them to create adhesive, meaning it can remain in the host in clumps. Golden staph has many toxins that cause pyroptis and necropsis in neutrophils and macrophages. Pyroptis and necroptis are both forms of programmed cell death that promote an inflammatory response. Although anyone can contract golden staph, there are certain predisposing factors that could exacerbate the infection. Those who have a vulnerable immune system or have a chronic illness, such as those undergoing cancer treatment, are more susceptible to contracting the disease and a more serious risk of complications developing earlier, because their body is not able to battle the infection as well. Also, those who have recently undergone surgery, such as for a pacemaker, are placed at a significantly higher risk of developing septicemia through contamination of the implant. Any questions?
What are the best treatment options?
For that, I'll hand over to the Minister.
Treatment varies for golden staph depending on the type of infection. Staph infections in the digestive tract will almost always resolve without additional treatment, but some over-the-counter nausea medicines may be recommended to minimise vomiting and discomfort. For all other infections, different types of antibiotics will be prescribed. For example, the best treatment for an infection inside the body is an oral antibiotic tablet, whilst a topical antibiotic is used for mild to moderate skin infections. However, these medications might not always work, as certain substrains are MRSA, antibiotic-resistant strains. In this case, those infected must undergo further sampling in order to find correct antibiotics. It is critical that everyone finishes their dose of medication, even if they feel better, to prevent the infection from returning, which would then make it MRSA. Those with a skin infection can also be treated by wound drainage, where a healthcare professional cuts open the infected skin to drain any fluid, such as pus, and then the wound is thoroughly sterilised. In rare cases, if the infection is caused by a surgical implant, emergency surgery must be performed to immediately swap for a new sterilised one.
Created using Powtoon.